Hello, everybody. Thank you for joining us. We're just admitting everybody in. There's quite a few of you here tonight. So just hold on tight. My name is Phoenix Lam. I work for communications at CBC Vancouver. I'm your moderator for tonight. As you came in, you will notice that a message saying that you're being recorded. So you are. You're likely going to be recorded and used on our YouTube or for our March 10th session. So if you're uncomfortable with it, you can turn off your camera. We did have everybody sign waivers earlier, but we do know that not everybody is comfortable being on camera. So if you're not comfortable, please turn off your camera. We'll get started soon, but we're just going to give stragglers a little bit of time to come in. And I'm just admitting people, yes. As they're coming in, I'm like trying to admit everybody. So hang tight and we'll get started shortly. We're just making sure that we can get everybody into the room as much as we can. And I see some of you are familiar with Zoom and you've already messaged, hi, Sylvester Law. Very nice to meet you. So we are gonna get started in about 2 or 3 minutes. As you know, you're joining us for our wonderful community conversations about vaccines and communication in multicultural, diverse and non-English speaking communities. We have Isabelle, who's our host for CBC Vancouver Weekends, and Dr. Gina Ogilvie with us. And just hang on tight and we'll get started shortly, okay? And bonsoir, MC, is that your name? M and then dash CEE. Hope I'm pronouncing that correctly. Oh, right. I forgot to mention, we do have technical support on hand. They just messaged in the chat, technical support. So if you have issues with audio or video or just any questions, you can direct message technical support. In the chat, you can see a button that says to everybody. You can select to technical support and it'll be a direct message to them. And they can see if they can help you out. No guarantees, but we always try our best, right? And it is Zoom, so we won't judge you if you have cats that come across the screen or forget to unmute yourself the first time you're asking questions. All right, so it is 6:03, so I think we can get started. So for everybody that's in the room right now, I hope you are ready because we're going to have a great conversation tonight. And really, this is leading up to our community town hall on March the 10th. It'll be on CBC TV, radio, and online about general vaccine questions. Tonight is really about talking, really giving us the opportunity to talk about issues about communication challenges in diverse communities in BC. So it really is a chance to do that. So if you have questions about that, you can, after our first 10 to 15 minutes of the fireside chat between Isabelle and Dr. Ogilvie, you can drop it in the chat. And the bottom of the bar for your Zoom, you'll also see reaction. So you should be able to have a reaction that raises a hand. You might not have raise a hand, but you can certainly choose one and Isabelle will be able to see you on screen and select you. You can also do the old-fashioned wave. You can do the old-fashioned wave and Isabelle will select you as well. And then basically we're just gonna do 10 to 15 minutes as I talked about of Dr. Ogilvie and Isabelle, and then go on to your questions. So without further ado, I want to introduce you to Dr. Ogilvie. She works for Women's Health and Research Institute and has been done various studies on multicultural communities and rolling out vaccine and vaccine hesitancy. So I'll give it over to them. And thank you everybody for joining us again.
Thank you all for coming on this 6 p.m. Evening to join us in our CBC living room. I love seeing this gallery right here because I can see all your faces and I haven't gotten a chance to hang out with this many people in so long. I'm sure you haven't either. So this is the biggest party I've had in a long time. And what a great opportunity for us to be talking about COVID-19 vaccines and diverse communities here in BC. And Dr. Ogilvie, maybe we can start off with a little bit about your experience and your background when it comes to vaccines and diverse communities and diverse groups here in BC.
Well, Isabelle, thank you so much for the invitation, and it's lovely to see everyone here tonight. My name is Gina Ogilvie, and I work with the Women's Health Research Institute. I'm the associate director there, and I'm also a professor in the School of Population and Public Health at the University of British Columbia. And my background is both in medicine, family medicine, public health, and also I spend a lot of time as a Canada Research Chair studying a whole variety of things. But one of the things I've spent a lot of time on is on vaccines, vaccine uptake, and how do we optimize vaccine uptake across the board, but also with particular communities that have a history of being concerned about vaccines.
And tell us a little bit about your study that you conducted and you were looking with your team. There is an increased hesitancy for the vaccine in non-white and Indigenous respondents. That's really interesting, and we want to know why. What are the things that you're finding out? And tell us a little bit about that study. What are the things that you guys found?
Yeah. So when the pandemic started in about March, the team of research at the Women's Health Research Institute, we really recognized that there was a need for us to do some research overall on women's health and really to have a sex and gender lens at the impact of the pandemic controls. But we also knew there was going to be a vaccine coming out. And given my experience with vaccines, I wanted to understand in advance what were the concerns about hesitancy, because how in public health we work is we need to know that information and then we can tailor and structure our programs to respond to that. So it's very much a question of we need to know in order to plan and optimize these programs. So we did a large survey that we sent out across the province to participants. And in the end, we've got now about 6,500 respondents. And we asked them a whole variety of questions about what did the pandemic mean for them, the impact on their mental health, the impact on anxiety, impact on their health-seeking behavior. But we also spent a lot of time trying to understand what did they think about the idea. It's hard to think back, but remember there was a time when we didn't have a COVID-19 vaccine. We weren't so lucky. Now we've got 3 here in Canada. But we said, what do you need from a vaccine, and also would you take it? So what we did was we asked people, do you intend to take a vaccine or not if it's recommended for you? And what we found was in British Columbia, about 80% of people said, yeah, I'm going to get that vaccine. So that was a great result. But what we did was actually delve further. So we used some really established psychological scales to try to understand what, as you just asked, Isabelle, what was underpinning it? Why did people say they want to get the vaccine? So we looked at it in 2 ways. We looked at sort of demographics, and then we looked at attitudes to vaccines and attitudes, concerns for vaccines. So when we looked at demographics, what we found in British Columbia was that certain groups, certain people were significantly more likely to intend to get vaccinated. That's older people, so people over the age of 60, significantly more likely to get the vaccine, say they wanted the vaccine. Men said they were significantly more likely to want to get it, folks with higher education, and folks who said they were essential healthcare workers. But the folks who told us that they were less likely to want to get the vaccine or intend to get vaccine were people who had self-identified as Indigenous, people who self-identified as non-white, and particularly folks who self-identified as South Asian background or Black background. So that was our first set of data that really elevated our concern and said, hey, we've got to make sure here we're working closely with diverse communities. And for those of you, and I'm not sure how many of you are involved with community work or in healthcare, but for many folks that won't be a surprise because there has been a history of concern in certain communities about vaccination. So this data confirm that. I also want to just then flag for you that we also found that there were some communities that had good intention to vaccinate. One of those communities was the Asian community. So we can also look at communities to be leaders and talk about how do they work with their communities, so that we can also learn from that. Why don't I'll let you jump in there.
Yeah, that was going to be my question. What did you find was at the core of the difference between communities saying our community is more encouraged or wants to be involved in vaccination, where there was a group that maybe didn't feel as comfortable? What is the reason there? What are some of the things that you found?
Yeah. So what we also did was use two kind of well-established scales to understand people's sort of psychological thoughts, their understanding and rationale. So we used one scale that's actually from the WHO, and it looks at what we call vaccine confidence overall, and also concerns about risk. And what we found with diverse communities was there was an overall less confidence in vaccines overall, but also a higher concern about risk. So those were some of the two things. The other thing we looked at were some other psychological things, which look at things like, what are your overall attitudes to vaccines? What do you think if you needed a vaccine, you could go get it? Do you think who around you would influence you to get a vaccine? And so what we found was that folks who were in specific diverse communities had lower attitudes towards vaccines. So they were more likely to say, I'm not sure it works. I'm not sure there's value to it for me. They did express concern about actually being able to get a vaccine. So that's really important when we think about how we plan our program. How do we get to people? And then they were also more likely to say some key influencers. So key influencers in British Columbia are people like Dr. Bonnie Henry, their family physicians, and family members. So when we think about how do we work with communities to help support them, one of the important things is having folks like Dr. Henry and community folks that are leaders for them talk about the vaccine.
Well, I was going to add, Dr. Bonnie Henry has been a great figure for some people, but she only speaks publicly in English. And of course, there are diverse people who do speak English, who speak and can understand it. Some people don't. So if you don't have that connection, and I know in some cases, some people don't have the connection for Dr. Bonnie Henry, but if you've got that connection, but you don't speak the language, how do we connect people with that resource, that person that has been kind of leading BC through these steps? Are we not ignoring a big chunk of people who perhaps don't understand what she's saying?
So I think that's a really good point. So first, I think what we want to do for non-English speaking communities, I think we need to actually spend a bit more time understanding who are some of the key influencers and leaders. We know that data from Black communities in the US particularly shows that spiritual and faith leaders are very important. We know that work with the South Asian community also shows that spiritual and faith leaders are really important. So we want to, one of the things we need to do is, as the regional health authorities start to roll out their programs, we need to make sure we, one, understand who are the influencers, to use a social media term, but who are the sort of key influencers for those communities who have authenticity, who can speak the language, but who also who are leaders for their community and sort of who have respect and are looked up to. But I also think we want to make sure they work very closely with folks like the medical health officers, with Dr. Henry, to make sure that they have all the right information as well. I know Dr. Henry herself has sort of worked, for instance, with the Filipino community, and one of the reasons she was so keen to get her vaccine at with the long-term care workers was she really felt it was important for her to show solidarity with them. And so that was one of the reasons why she was so keen to do that.
And I was going to bring up, we found recently the report that came out saying that there is systemic racism in our healthcare system, specifically against Indigenous people. When we see a report that says there is evidence that this is happening, then we see hesitancy is more prominent in those groups. What do we do to kind of address that? Because we're looking and saying the system is the part of it that's that's flawed, and now the system is asking for these people to trust us?
Yeah. So yeah, there's a lot behind that question. So I didn't present the data on Indigenous folks who responded to this survey, but I have spoken to the First Nations Health Authority about it. And indeed, as well, Indigenous folks reported they were significantly less likely to intend to get vaccinated. And so you're referring to Mary-Ellen Trapel-Lafon's report about Indigenous racism, anti-Indigenous racism in British Columbia. And I think what you're touching on is that experience is real also for many other diverse communities. And so when we then say, as you said, oh, here's a system that maybe has ignored you, that has offered you poor care, that has not treated you respectfully. Oh, but by the way, we want you to come in and get a vaccine. That's a circle that's tough to square, right? And so this is why we need to, at the core, be working with those communities to build trust. I think beyond the sort of systemic racism, we also have in communities awareness that there have been very unethical studies that have been conducted without proper consent, without proper sort of engagement of the community, with the data not shared with the community. So we also have this history of what research and studies have been, which then further undermines people's sort of engagement and willingness. I think what's heartbreaking for folks like me in public health is we also know those are often the communities, and in this case in COVID, who are shouldering the greatest burden of the disease. So the folks who we most want to get vaccinated because their community is suffering the greatest, and they have the most hesitation. And I think what's really important to what you said, Isabelle, is that folks are, they have they have this experience and they know the racism exists. So then they are understandably very hesitant. So that means as public health and as health authorities, we have more work to do to build that bridge and encourage and support and to meet folks where they're at.
And a quick question, just you touched on something. You said a lot of the times these communities are actually more impacted by COVID. Can you tell us really quickly in what sense we're talking about that?
Yeah, so, and I'll talk to that in two ways. So in British Columbia right now, we aren't able to get race disaggregated data because we haven't got a process for that. I think one of the things, and you've probably heard it in press conferences, is we really are trying to move forward with that. And I know the Ministry of Health has that on the top of their sort of priority list and really is trying to get community consultation around that. So for folks interested in this area, really keep your ears open for that. When we look though at data that we can get in Canada, so we look at places like Toronto, places like Ottawa, who have been able to look at race disaggregated data, we do see a significantly higher burden of hospitalization and death in diverse communities than we see, than is actually representative of the population. Other data in Canada, which is a bit less precise, but also informative, shows that if you look at neighborhoods where there are predominantly diverse communities in those neighborhoods, they often report higher rates of COVID-19 infections or SARS-CoV-2 infections. So again, we see it in a couple of ways in Canada. This is one of the other reasons why Dr. Henry and folks are really looking to start to get this data. And I see someone is saying that Winnipeg is releasing their data. So I think the issue for BC is we're looking to start to gather that data and also try to look at proxies and accurate proxies. And Isabelle, though, I do also then want to just talk though about when we do get the data, so we know that there's sort of higher rates in communities of color and diverse communities. When we looked at self-reported intention to get vaccinated, when we looked at sort of overall folks who were non-white versus white, compared to that 80% I said overall, 70% said, I'm going to get the vaccine. When we look at folks who self-identify as South Asian, 58% said, I'm going to get the vaccine versus 80%. And when we look at folks who identify as Black, 45% said they intend to get the vaccine compared to 80%. So we have a major challenge here because we want these communities to be benefiting from this great science and great intervention to keep them safe and their families safe. So we've got a lot of work to do.
And I want to make sure to add, we talk about these numbers, and sometimes I fear that we're not looking at this holistically, in the sense, we're talking about history of systemic racism in some cases, or bad experiences. This is not 45%, 50% because they don't care about health, or that they, whatever other thought we could have, but that there is reasons for this and that we need to look into them to fix them. But when we're in a crisis like we are in the pandemic, we don't have years to fix these things that are sometimes have taken generations. So what do we do in the short term when we need to address this crisis right now, but a lot of these responses and the hesitancy comes from decades of trauma?
You're 100% correct. So we are the legacy, what we're seeing here is the legacy of decades, centuries of experience that manifests in these very real ways for people saying, I don't trust this system because this system has never treated me well. So I totally agree. We don't want to sort of paint people as making poor choices. For them, this makes sense to be hesitant and to be a bit cautious. So I'm a researcher. So the first thing I'm going to say is we need to keep doing research. So, and part of that comes from my public health practice lens, which is that you need data to guide what you're doing and how to sort of direct and prioritize. So, I think one of the pieces of data we want to do is look at how do we better get a handle on coverage rates in different communities. So I think that's one of the first things. And we want to keep monitoring that. We want to make sure, I know, in our new phase plan, Dr. Henry's very keen to make sure that we have great coverage across all communities, all diverse communities. I think, though, the second thing is we need to listen to what some of the science has said. And what we know is that there are ways to work specifically with communities. So one of the most important things is actually to have programs that directly target those communities. So you mentioned language. So making sure, and the operations lead for Vancouver Coastal yesterday was showing the documents that they have that are in about 7 different languages. But not only that, we need to have people who can answer the phone in different languages. We need to have folks that have information that they can actually share with their communities. So it's not just the information, it's where do you hold vaccine clinics. We need our mass clinics for sure. We need our large scale, wherever we're going to hold those. But we need to also meet the community where it's at. So if certain communities have a community hall where they feel comfortable and welcome to go, let's look at having vaccine programs there. We want to also, knowledge doesn't always change behavior, but it's a good foundation for it. So one of the things is we want to make sure that knowledge is out there with community radio, in settings where people gather, in languages. I know it's tough to gather right now, but even for community Zoom meetings where people can actually hear and ask questions in their own language. One of the things is actually working with the convenience and access. So there have been some great programs with mobile vaccines in the US. Can we learn from those? So there's some really great evidence-based approaches we can take. And I started out by talking about faith communities, and faith communities are really important places, and faith leaders, and similarly Indigenous elders, have huge influence in different communities, and we need to really tap into those folks as well.
Okay, I'm just gonna jump in. Thank you so far. This has been so interesting. So what we're gonna do is because this portion, we're gonna move on to some questions from the audience. I already see some in chat, and we had some pre-submitted. But maybe what we can do while we're just warming everybody up and getting used to participation is I'm gonna throw up a poll and just to see where everybody is feeling about this. So the question is, how would you rate the vaccine rollout response so far in BC? And so we're gonna launch it now, and takes a few minutes to answer it. And then in the meantime, I think Isabelle may ask a question from the audience that was pre-submitted.
Yeah, let's take a look at a question while you guys answer that one. This one I think is really interesting. So is there any research on how vaccines work for different ethnic groups? So we're talking about hesitancy, but what about effectiveness? Is the vaccine working for ethnic groups? Are we even looking at that?
Yeah, no, that's a great question. And actually, it was a really important question when we looked at vaccine approval. And for those of us who spend a lot of time looking at things like vaccine protocols and the clinical trials, they actually did a really great job, I would say, of having diverse communities. So for instance, if you look at the Moderna clinical trial, you can see that there's a real great cross-representation of different backgrounds that really actually represent the states. So we have thousands of folks from different diverse communities, different ages, who participated in the trial. And actually, when you look at some of the FDA submissions and that kind of thing, and they've actually broken down vaccine efficacy by different communities. And you can see it's actually a very strong response across all communities. So that's really great news. And I think that is something actually that they did quite well.
Phoenix, I don't know will we be able to see the results of these?
Yeah, it looks like about 62% of people have voted. So I can actually share the results on screen with you guys quickly. Okay. So it looks like it's coming in kind of like 3. Like so far, people are feeling vaccine rollout so far has been 3. I think that's where we're at. And what we'll do is we'll also ask a second question, and then we will ask.
I'll get your thoughts quickly while we ask a second question. What do you think about that? Getting a 3, 60% saying 3. If I was then a school grade teacher and I got a 3, I mean, we're talking about like a life-saving rollout here. 3 is not, a 2, but it's not great yet. It's not a 4 or 5.
Yeah. 3 is a 60%, and if you grew up in my house, that wasn't a type of mark you were allowed to bring home.
Not acceptable in my household.
Yeah. I think I have a couple of reflections. I think what I will say is I think because I straddle sort of the research and practice world, I do know how hard everyone's working. So I know everyone is at the front line, all the way from the sort of that direct care provider to those rolling out the vaccines, are really working as hard as they can. So I think I may be a little biased with this. I think the other reality, is that we in Canada are a little bit handcuffed because we are at we don't produce our own vaccines. And I think that's one of the lessons that we've taken from this. For folks like me who have been involved in public health leadership, our lack of vaccine and pharmaceutical manufacturing is an issue. And I think now the public gets that. And so one of my hopes from this pandemic is that people will understand and have a sense now of how important it is to have national manufacturing. We saw it with PPE, we're seeing it now with the vaccines. So I think I think our teams in BC, our teams across the country, our teams nationally are sort of wearing that. But that said, I think, there's a lot of moving parts, and we're always trying to do better. And I think one of the great things about this town hall is I will now have data that I can actually reflect back to health planners, health policies, and say, we can't forget this. And they're really receptive and interested. So I think we're all working as hard as we can, but I think this is a great, great way to get sort of information back as well.
Great. We have one last poll question, and I think we also have questions in chat. I'll let Isabelle grab those. So the next poll question is: given what you know so far and what we've discussed tonight, are you comfortable being vaccinated? And we can answer yes, no, you're unsure, or if you prefer not to answer, you can do that as well. So I'll launch that poll, and I'll let Isabelle get into some of the questions.
I'm really curious to see this one. I think this one's really interesting because we've had conversations, even, in our newsrooms. People are still hesitant and you wonder why. And I think, again, we were talking about a broad stroke. It's very dangerous if we start painting people who are unsure or nervous about it with one stroke. And we really need to look at the questions as to why. Like you were saying, a lot of diverse communities are worried about that. So maybe let's take a look at a question here. I saw one here, which, you know, I don't know how much you specifically your research is on this, but I think it's an interesting one because we're talking about diversity here. What are the positive and negative sides of a vaccine passport? So this one's interesting because we're talking about essentially making it part of your identity and being accepted or not accepted into a country. What are your thoughts on that? Just hearing about that.
Yeah. So, I mean, this is a very challenging ethical situation. And I think let's take the language in immunity passports, a very sort of, I think, inflammatory language. I think there have been countries. So for those of us who've traveled, we had to, if you traveled in the past, you often had to show if you had yellow fever vaccine or not. You had your card that does that. So I think what we want to talk about is if we are asking people to show whether they've been vaccinated or not, if that's a direction we go, and I'm not sort of endorsing it either way, what we need to think about really is, what are we trying to do with that? What is our reason for that? And are there other ways, if folks choose to have chosen not to be vaccinated, are there other ways? So do we ask them then to wear a mask? Are there other things? So we need to be really mindful of, what is the question? But I do want to just really, encourage people to recognize that, and we talked about that people are hesitant. And one of the things, if you're hesitant, is to get information, and your sources of information are really critical. And we've got a few things in the chat. One of the challenges we have is, of course, social media. Anyone can put literally anything. And I've done lots of vaccine work over the years. And I remember being at a city council meeting where this woman got up to read something she saw on the internet. And she started to read it to me, and it was completely inaccurate and completely wrong. And so I sort of explained it to her, and she said, "Oh, but it was on the internet." And then I said, "Well, it's a blog." And she didn't know what a blog was. And I had to say to her, that could be your neighbor's son who's 22 and out of a job, sitting in the basement writing away. And she just hadn't understood it. So we need to really work in our social media to make sure, and I was at a great presentation by a guy named Tim Caulfield today, who talked about the role of combating misinformation on our need to be there. What I would really encourage folks, I can tell you, I just want to make sure that this vaccine is, the 3 vaccines we have are incredibly safe, incredibly effective, and strongly recommended. And so if you have questions, one of the places to go is good source of information. So I really encourage you to look at places like the BC CDC website, which has really robust, evaluated, very clear questions. So I just want to make sure I say that before we go on to our next question. But I'm delighted to see that we've got 63%, and those unsure, we can get you the information you need to you feel sure.
Exactly. Okay. We're talking about the 4-month waiting period. Again, I don't know, we do want most of these questions to be for the town hall on March 10th. So you'll want to watch that. That'll be online as well. So these are more general questions. So maybe you'll be able to answer this, maybe not, but we're talking about the 4-month waiting period. Yeah. Obviously, we've been talking a lot about that because Dr. Bonnie Henry has just recommended that so that we could vaccinate more people. Now, federally, the advisory has come out saying, what if some people after 3 months test positive? Would the criteria change? Yeah. So obviously this is not your expertise, but maybe a little glimpse at the background.
Sure. Yeah, I can actually speak a bit to this. So for folks who aren't from Canada right now, what has happened is our national advisory committee has actually said, instead of giving necessarily the second dose at 30 days or 28 days, or we can actually extend it out a bit to 4 months. There's a good reason for that. One is that we don't have enough vaccine right now to give everyone 2 doses that we would like to. And the second thing, though, is that we know after 1 dose, we get a really great response. And Dr. Henry showed some great data that is so relieving when you look at the sort of reduction in outbreaks in long-term care facilities and in healthcare workers. So we know that we have a really good 1-dose response. So that's very exciting. The third thing is that for those of us who've worked in the vaccine world for years, this is actually based on really good vaccine principles, which is that you don't sort of get a rapid decline in vaccine antibody responses. You get protection, and then your boost actually elevates that. So it's based on a number of things, but it's actually based on really good science insofar as we have great evidence around one dose, as it's covering people right now. And we've gotten, very few outbreaks in, as you can see in our data, in any of our long-term care facilities now because they've been fully vaccinated. And we have the experience with vaccines, and we have the data for this COVID vaccine. So I think that's why NACI recommended it. And I think it's a great idea to try to get as many of us vaccinated with one dose as we can, so we can start to open back up society as much as we can.
One comment that's getting a lot of reaction or support is Sammy Joe says, when the BC government has the new orders or info, the translated info is not released at the same time. It takes days to get the translated info, so our communities are left waiting and do not get the info in a timely manner. I think there's several problems or concerns with that. Not only does it take a few days and you don't get the info, but does that not make the community feel like they're less important? And how do we tackle that?
Yeah, no, and I think that's a really important point that you make. And we do want to try to shorten that and have it, even things held, coming out simultaneously. I think, folks, this is the kind of feedback that we need to get to our health authorities, and they're very keen. What I can say is that they're very keen to ensure that there's no inequity. I mean, equity has been a really big focus of our vaccine programming. So I think to make sure we communicate that, and I think to make the point that we need to have as close to, if not simultaneous, release of information so that folks can get to it. There was just one follow-up I wanted to make around the point of equity and the fact that one of the reasons why we need to really focus on vaccine hesitancy, and particularly in diverse communities, is what we don't want to do is to enlarge inequity. We really want to actually work together to decrease it. So that's why adding that extra effort and extra engagement with these communities is so important.
I did have a question here that the moderator flagged for us. Queenie says, how do you ensure the hard to reach seniors who are digitally challenged with language barriers and mobility issues be able to access vaccine?
Yeah, no, I think I saw that question. And so I think one of there have been some good plans around this. First of all, there's phones. So I think it's really, my parents are in their 80s. And so the idea of them sort of having to go online and find an appointment, it's a bit nerve-wracking. So I think that's why they've gone to the phone idea. They've been really clear. You don't need to have your PHN. You don't need to, you just, report your date of birth, and then they can go through your date of birth and you bring your ID. I think at the start, there will be more sort of these mass clinics. And then I think what you're going to start to see also are smaller clinics, and perhaps some of these more programs where people are, for instance, taking out mobile vans. I think they are getting these going. We've just moved into the next phase, and so I think what they're trying to do is get the big clinics going. But I do think that that's a really important challenge that we have to make sure we address.
There's another one that I want to get to. There's so much conversation going. I love it, but some of these are getting lost here. One question was about your study and your research, and I can't seem to find it, but it was something to do with, did you see religion and religious people who are religious have more hesitancy to the vaccine?
Yeah, so we asked about your engagement in spiritual matters and how important that was to you. And in this case, we didn't see it overall. But remember, this was a provincial survey. This is where I think the data shows quite strongly in specific diverse communities that spiritual leaders are important. So even though our data may not have shown it, That doesn't mean, I don't think that when we're working with specific diverse communities, that we shouldn't work very closely with our religious and faith leaders, because we know that they are very influential for a lot of communities, and that will be a really important way for people to feel confident and to feel and to understand the importance of vaccination.
Would that be one of the challenges? Is because, of course, we've heard that churches, mosques, services just aren't. There's an order that they can't go on right now, and we're saying that, especially in these communities, that's really where they get so much of their information is from their spiritual faith leaders. When you have that disconnect, is that part of the challenge here? Is that at the end of the day, we're saying those people, we need to work with those people, but we need to close the churches. So is that part of the challenge?
Well, I think what the physical space of the church may not be open, but certainly communities have been congregating online. And actually, I know many churches and faith communities, mosques and temples have been very, very active on Zoom. So I wouldn't say that there's not connection. I would say there's actually still very robust connection. And that's where I'm saying we can actually really work with those faith leaders to continue to leverage and use their authentic and really deep connections to the community to support vaccination.
I also want to encourage everybody, if you have questions and you want to ask as well, not through chat, if you want to do video, or if you want to pipe up and you have something to say, to use your reaction button or wave at Isabelle and she'll grab you. But other than that, this is such great questions, so we'll welcome all your questions, and we're so lucky to have Dr. Ogilvie here answering them.
Yeah, I'm so happy to be here and having these conversations. So one study that Stat Canada had looking at 43,000 Canadians found that Canadians with Asian backgrounds are more likely to report increased racial harassment during this pandemic. How do we respond?
Yeah, and there have been some really important discussions of that in the media. And what an awful thing that is. And, you started, Isabelle, talking about why people are vaccine hesitant and why people are hesitant. And again, part of that is they have these very real lived experiences which undermines their trust. And so part of what we want to do is, and I think we've got some things where we know where there is no one community to blame for this pandemic. This pandemic is a global pandemic, and we're all in this together. And so to target single communities is just an awful thing. And I think we all should be coming together to speak loudly and speak against that. And I think that one of the other important things is for us to come together as communities and support each other communities. So in fact, I think, some of the questions and ideas from the Asian communities about how to engage with your seniors, how do you do best practice? That to me is some really important peer leadership that community can actually say to other communities, hey, we found this worked as we tried to work with our community partners. So I think what we need to be doing is building those bridges across the communities and building those bridges to actually help us learn from each other. On the previous session, which was with Indigenous communities, there's a lot of also really great ideas in Indigenous communities about how do you engage those members who are hesitant, how do you engage communities that are harder to reach, and we need to be sort of sharing some of those ideas.
I'm curious to know your thoughts on, because I see a lot of comments here about misinformation and how to get real facts. I'm curious to know what your thoughts are on if anyone in our group here knows personally someone who is sharing misinformation or seems to be very hesitant. Is there any suggestion? Is there something that we can do? We're all in this global pandemic, and it seems like sometimes it's hard to combat that when you're, one person is saying this is fact, and is there any suggestion? Is there anything that we can take away here and say this is how we move forward?
Yeah, so I can jump in here, and we had the Women's Health Research Institute had our annual symposium today, and a gentleman named Tim Caulfield, and for those of you on social media and Twitter, he is someone I recommend you follow. So he's a real expert on misinformation, and he gave our keynote today. So he talked about how you tackle misinformation. So he said one of the first things is actually to respond to it quickly. And he said to respond to it quickly, respond to it accurately, and respond to it kindly. So and I thought that was really interesting that he said, we can sort of elevate the energy by being unkind. The other things he talked about, and I really strongly recommend, is going to established sources of truth. So things like BC CDC, Public Health Agency of Canada, Vancouver Coastal, Fraser Health, whatever your entity, your health entities are in your community, and use and re-up and re-amplify that information. So that's the information you want to be amplifying. So linking people to that kind of data. But I thought it was interesting that he said, we need to respond to things quickly if you see it, so that it doesn't actually build a life of its own. So those were some of the things that he talked about today. And it's really, because sometimes when I see things on Twitter or Instagram, I kind of go, oh, I should say something, but But he did talk about how important it was to do that very quickly.
Well, I was going to say, I think a lot of us probably in this chat can feel this. It's exhausting. And sometimes it feels like, am I going to even get through? It's exhausting. And if this person is not seeing the way that I'm seeing, is it even worth my energy? Because this pandemic is exhausting in multiple ways for different people, working from home, being isolated. And then on top of it, to feel like sometimes we have to educate is just, I think, exhausting. And I saw a few people nodding their heads. So I think, how do you tackle that? Because that's an extra job on us, right? And at the end of the day, we're not all researchers. And how do you kind of balance that, taking care of yourself and not being so exhausted?
Yeah, and that, what you've also nailed something really important. So at the end of the day, self-care is really important. And, there are ways to, for instance, mute people on social media so you don't see it, so it doesn't get you going. But there's also ways to say, one of my colleagues, she says, I sort of allocate 20 minutes a day. And that's what I do. And then I feel like I've done my part. So you can also put your boundaries on it. But I do think having some strategies around, really recommend that you go to this website. They will, here's the data on that. Just some really simple, kind links so that you're not necessarily the one responsible for answering. But I always say, go to a website where it's someone's job to be right about this stuff. Because because then you've got skin in the game, and their data is going to be accurate and correct.
And I guess that's one thing that we can all from this session, because one of the things with these sessions, I love talking, discussing these issues that we're all feeling, but what can we take away? What can I actually, in terms of action, do once I get out of this? Because we all signed up for this session because we're clearly interested. How do you bring this knowledge to people who didn't sign up because they didn't want to take part? So I guess one of them is to have that information ready, and then you can send the link and not put more energy than that. That's one of the actions, I guess.
Yep. Yeah, absolutely. And, I see Jennifer Hudson-Phillips has put a comment in here where I think this is actually really important too. So how do we get information about there? You need to sort of return to the same topic again and again for folks to really understand it. I mean, the reason I can talk about some of this stuff is I've been immersed in it for a long time. So you can't expect, oh, I said it once, they're going to get it, right? And so I like what Jennifer's put here is you have, information sessions where people come with their questions. You respond to the same questions, maybe several times, maybe in several different ways. Maybe you have another session, because that's what's going to really start to get people feeling confident and being able to respond to questions they have as well.
And Queenie, I think you might have raised your hand. Do you want to unmute yourself and ask your question?
Sure. I don't have a question, but I certainly appreciate the discussion here today, and thank you for the wonderful sharing of the takeaway message. I was going to type it about saying that I think it's important to ensure the language used in any of the sessions, platforms, or communication needs to be very plain and simple language that people, in general can understand, especially for those people with language barriers. Try not to use those big terminologies and use very simple terminology, and making sure those people who have the barriers in whether it's physical barriers or cultural barriers or language barrier, they are able to overcome it. And if they have a questions, making sure you connect them with someone who will be able to guide them, to give them the information so that they can make an informed decisions.
Well,
I think it's very important.
Yeah. Sorry, I was going to say that's a great question and leads me to a question. Do we have that currently? If someone doesn't speak English, who do they call if they've got a vaccine question? If they get the vaccine and they have side effects, like what are we supposed to do? And do we currently have that in place?
Yeah, so let me jump back to what Queen said, and then I'm going to answer that. So Queen, what I really love that you underscored there is the need for really good knowledge translation. And what I think public health has learned, we've got our media colleagues here who are really expert at it, but we now have sort of more in-house KT specialists. We call them KT specialists, who take what we write and they say, yeah, and they scratch it up and go, you're using too many fancy words here. No one's going to understand that. And they, it's like a vicious editor who sort of tears apart your writing. But that's what we need. So that's the first thing. And then I think to your point, Isabelle, I think this is the kind of feedback we need to and want to make sure that that the health authorities have. I know, for instance, Vancouver Coastal has now a lot of their documentation in I think it was, last time I saw it was 7 languages. So I think people are really working towards that. And I think, the more we can do that, and the more we can engage with community groups who say this, we need this prepared, we need this developed in this way, the better the system's going to be.
And I'll remind if anyone wants to ask a question or make a comment, wave your hand because we can see you. Let's see if there's another one here that I might have missed.
There's a question by Sylvester here, if you don't mind. He talked about a vaccine clinic in churches, temples, and mosques. I think that the health authorities are very willing to be very creative as they go forward. I think right now they're looking at large type of clinics, large type of mass clinics. So I think we may not see this in this phase, but I think they're really willing to, we've heard their ambitious plans to get these vaccines into the arms of everyone, by July. So they're going to need space. So I think that these are the kind of creative solutions that we need to think about and are actually evidence-based when you think about reaching diverse communities.
Got a pre-submitted question here. How long does the vaccine immunize you from the COVID virus? Do we know that?
We don't know that yet. What we have from the clinical trials, which sort of ended or started reporting out in kind of November, December. So we have that right now. What we do know, though, and the companies have this data more so than we do, but what we know is that usually antibody titers are relatively stable for a bit before they start to sort of decrease. We're also going to be getting a boost here in British Columbia, so our second shot. So I think this is going to be one of the important questions. The other thing is whether we'll need boosters, the timing of future boosters, that's going to be the kind of ongoing evaluation research that we need to do.
And for people who are hesitant to get the vaccine, I've heard a few people saying they want to wait until there's enough people vaccinated so that they won't need to get one. Is that going to be the case in BC, where there's a point where the province is going to come out and say, you know what, we've got enough people vaccinated, you don't need your vaccine? Do we think that could happen?
I don't think that's going to happen. And I would flip it the other way. Right now, already in Canada, over 1 million, almost 1.5 million people have been vaccinated. Like, there are a lot of people, even just in Canada. In the US, they're vaccinating 2.5 million people a day. We know this vaccine is safe. We know we are carefully monitoring for any safety signals. There's no safety signals. I had mine, because I do direct care, I had my vaccine last week. A little bit of a sore arm. I'm happy to take that instead of COVID. And so I think what we need, what we need to do with folks is actually to encourage them to talk about what are they concerned about, because we are getting a lot of data now showing that the vaccines are very safe. And we saw that in the clinical trials already. Remember, the clinical trials had, upwards of 30,000 people in them, and we had safety data there. So, and I do want to underscore that we know that that one of the key things for specific communities, diverse communities, particularly the Black community, I'll say, and the South Asian community, they want to understand safety and risk. So I think one of the things that the Public Health Agency of Canada has done really well is actually you can go on every week and they update any safety concerns and you can track it yourself. So this is not coming through person A, you can go and monitor it yourself. And it's really reassuring to see the safety signals in these products.
We've got a few more minutes, so this is going to be probably the last few questions. If anyone's got anything, just wave your hand. Someone was asking, and this is a pre-submitted question, are Canadians out of BC, but BC homeowners eligible to get the vaccine? So let's say you are a Canadian, but we're currently not in Canada. How does that work? Do we know?
Well, what I went on the website today to help register some folks, and what it says is that if you are a resident of BC, you're eligible. So, and even if you don't have a public health number, you're able to get a vaccine. So, I would not let any of that stop folks. They want to get folks vaccinated. So I would call, the numbers are on the Immunize BC website. They're on the Ministry of Health website. So I'd really encourage folks to call, and when you're eligible for your time, and it's all listed there when you should phone, if you're over 85 versus over 80, et cetera, make sure you call in and you can register for the time.
And so, someone asked here, and at some point, perhaps most of us are going to get a vaccine. What should we expect in terms of knowing what vaccine we're getting? Will we know, or they won't disclose it to us?
No, you'll know. You'll know. I think what Dr. Henry said yesterday was you can't choose, but you'll know what you're getting, and it's written on your little card, and you'll have it with you. And I think what I'd really encourage people to just remember is that all of these vaccines, so in Canada right now, we've got the 2 mRNA and AstraZeneca. For US folks, they also have J&J, Johnson & Johnson. So, and that's right now under review at Health Canada. What we know for all of these vaccines is, remember, the reason we're doing this is because we want to keep people out of hospital. We want to minimize the consequences of hospitalization, ICU admission, and death. That's why we're doing this. And all of these vaccines work incredibly well at preventing those. So, someone on Twitter said, which is the best vaccine and which vaccine I should take? And someone wrote back, and I totally agree, the one you're given.
Yeah, because I was looking at some of the data, and it says that the number is protecting from COVID or being sick, but there's certain, they're almost all 100% for hospitalization. When you look at that number of people getting actually sick to the point of getting the hospital, all of them are almost 100% effective. So when you're looking at that data, correct? Or am I?
You're totally correct. And that's what we're interested in, right? That's what we want to prevent. We want to prevent hospitalizations. We want to prevent severe disease, hospitalizations, and people passing away from this. And the vaccines all do a great job with that.
And we've got 2 minutes left. I see a lot of people thanking you for being on here today, because we know that you're very busy and this is a stressful time for people, and people have questions. Alice, I see you've got a quick question for us. Do you want to unmute yourself? Yep.
Yep. I read yesterday that the AstraZeneca vaccine is not for people 65 and over. So should those people avoid this vaccine?
Yeah, thanks, Alice.
Thank you, Alice. That's a great question. So just to remember, there's 2 processes. So there's the Health Canada process, which says, are these products safe? Can we use them in Canada? Then there's the NACI, National Advisory Committee on Immunizations, that says how we should use them. So Health Canada said, yes, AstraZeneca can be used for anyone. What NACI is saying, they said, we would prefer to see a little bit more information on the 65 and over. Not that it's not safe. They want to see more data for the efficacy. And what Dr. Henry has already said is that if you are over 65 right now, you won't be offered the AstraZeneca. They're going to prioritize it for a different group. That said, let me be clear, there is good data, and there's even more data coming out from the UK, yes, in the next few days about the benefit of the AstraZeneca in older folks. So I think we're going to find in the next couple of weeks that restriction will be removed. But rest assured, we're keeping an eye on it. But again, AstraZeneca was very good at preventing severe illness and death. So that's really what we're here for.
And we're just wrapping up here. If you had one thing takeaway for everyone that's watching this, what would be your takeaway?
My takeaway would be, I understand that some folks may have hesitation based on their really legitimate experiences with the healthcare system, their concerns of racism, and their concerns of being separated from the system. But what I want to stress is that this vaccine is safe, it's very effective, and as soon as you can get it, I would encourage you to get it to keep yourself healthy, the people you love healthy, and so that we can all get back to the lives that we have missed over the past year.
Right. Well, thank you both, Isabelle and Dr. Ogilvie, for tonight. It's been really informative. So for everybody that's still on, I want to remind you that on March 10th at 7 p.m. on CBC TV and radio, online on GEM, you can watch the full town hall. We'll have Dr. Bonnie Henry, we have Adrian Dix, and also a bunch of other people answering vaccine questions. So thank you for joining us for tonight and all your amazing questions. And hope everybody keeps healthy and safe, and we'll see you all very soon. Thank you.
Thanks. Bye.
Bye. Thanks for joining.